All right, next exercise we're gonna go through here is gonna be another great exercise for those with acute low back pain. This is a very good one to do if you have a tender low back, something that you can't even do if you're unable to walk, etc. This is a good controlled exercise. And we're gonna be using the body ball here in just a minute. And these body balls are a great, simple, low-cost investment for you. They're gonna really do a lot of good things for your health. And you can use these when you're watching TV. You can also use these whenever you're sitting at work at the computer. It's a very simple thing to do. It's gonna make your back stronger, holding your adjustments, but also what's gonna happen when we work on this ball is we're gonna be working the discs between the vertebrae. So remember, the discs are not a shock absorber. The discs are spacers that protect that delicate nerve that comes out of the spinal cord and that goes and feeds all of our organ tissues. And so the disc has to be well maintained because of the curve of the spine. So we're going to demonstrate that curve in a minute. Before we go into that, I want to make sure you understand that when Matt demonstrates this position, his core is going to be nice and locked and tight, just like when we demonstrated the seated position onto the bench or chair. If you want to know how your core gets tight, act as if someone's going to punch you and tighten up. That's the position that we want your core to be in when you're sitting on the ball, and also when you're going in and out of the chair in a very simple controlled motion. So we're going to demonstrate with the body ball now. Matt's going to go ahead and sit on the ball, and what I want to demonstrate first, so go ahead and have a seat, is I want him to actually just show that his back has got the right curvature. We're looking for that lordotic curvature, which goes just like this in the low back. He's going to exaggerate that now, and what I'm going to have him do is actually show poor curvature in the back. So he's going to slouch. You can see that rounded back here. That's not how you want to be. So you want to get that lordotic curve back in your back. Shoulders are nice and in line with the ears, and he has that tightened stomach as if we were punching him. And now he's ready to go. So what we're going to work here in this position is we're going to work the process called imbibition, where the disc actually gets stronger. And the disc gets stronger by using this dynamic surface, which is not a static surface. We recommend you putting it up against the wall to start so it's stable, and having a dynamic surface helps us to use our core muscles, but also engages that process called imbibition, where the disc gets shoved nutrients and oxygen, and also it removes toxicity and inflammation from the disc by using this up and down pumping motion. This is something where if you were unable to walk or unable to exercise, this is a great motion for an acute patient who's in a position where they cannot do that walking. And again, the imbibition feeds the disc and makes it stronger, and that pumping motion is what's going to feed or make imbibition possible. When he starts to do the bouncing motion, he's not bouncing up and down. Actually, he's doing a pumping motion. So it's going to look very controlled. As you get into it more, make sure you're not bouncing. It's very controlled. So Matt's going to go ahead and demonstrate just a slight motion. That's what we want to see. It's very controlled, and what he's doing is he's rocking and pumping that disc in a form of imbibition and strengthening that. And as he gets better, and as you pick it up, you can pick up intensity, and you can see it's more controlled. What you don't want to do is get wobbly and bouncy and lose that lordotic curvature. So right now the disc is very strong, it's very stable, and that's going to help hold those low back adjustments in order for you to recover from whatever's going on with the low back and injuries that you have. Now what he's going to do is actually demonstrate bringing that ball off the wall. So let's go ahead and have him stand up. And we're going to bring this onto an even more dynamic surface, which is away from the wall. And now he doesn't have the support. So again, we want to make sure we take a look at that lordotic spine. We want to make sure he has that curvature going on here. And again, Matt, demonstrate the poor curvature again. If you cannot keep the proper curvature and you find yourself doing this and you're not ready to do this without the support of a wall, he's going to go ahead and get in the good posture. He's tight in the core. He's going to go ahead and do the pumping motion, which again is going to strengthen that disc. It's going to make for a stronger holding spine and a really good exercise for my patients to do who have acute injury. You can do this throughout the day as much as you'd like. Probably start with 3 to 4 minutes at a time and just build your way up. If you want to start using something like this at work to sit on throughout the day, you will strengthen your low back and your core to be able to hold that and to be able to sit on it much longer.